Hello viewers, good afternoon. This is Reshma and today welcome to a very wonderful session of obstetrical and gynecological nursing. 90 most important bullet points with the image based questions and also theory part questions we will be dealing today. So those who are online, please confirm whether the audio and video is clear. Please comment in the comment section so that I will come to know whether everything is okay, clear. Rajeshwari, good afternoon. Tamil Selvi, good afternoon. So the audio and video clear, Tamil Selvi? So those who are online, yes. Thanks for the confirmation, Pasha. Okay. Deepak, thanks. Thank you. Sitti, good afternoon. Tamil Selvi. Okay. B. Kalyani, hi, good afternoon. Okay, let me start the session today. See, in the previous session, I have already, in my previous OBG session, I have covered few questions like a presumptive probable signs of pregnancy, Braxton Hicks contraction, Chadwick sign, Goodell sign. So, if you go into this video, this particular videos, the link I have put in the description box. There you will get this in the description box. There I have put the presumptive signs, probable signs, Braxton Hicks contraction, Chadwick sign, Goodell sign, Hagar sign. So most of the topics I have covered there. The rest of the topics I will be covering here today now. So you can go through this in my previous videos. Now let's continue the session. And today's session there will be about, so all the slides, ఇక్కడ స్లైడ్స్ కనిపిస్తున్నాయి కదా. సో ఈ స్లైడ్స్ కనిపిస్తున్నాయి కదా, ఈ స్లైడ్స్ నుంచి ఈరోజు మొత్తం మన క్లాస్ అనేది మొత్తం ఉంటుంది ఈరోజు. ఇంకా మన ఛానల్కి ఎవరైతే ఫస్ట్ టైం వచ్చారో వాళ్ళందరూ దయచేసి దీన్ని లైక్ చేయండి, షేర్ చేయండి, సబ్స్క్రైబ్ చేయండి. ఇంకా మీ నర్సింగ్ గ్రూప్స్లో తప్పకుండా షేర్ చేయండి సో దట్ ఇవి అందరికీ రీచ్ అవుతుంది. ఇంకా మన తెలుగు పిల్లలు ఏం చెప్తున్నారంటే, మేడం మీరు క్లాసెస్ దయచేసి తెలుగులో తీయండి అంటున్నారు. చూడండి, తెలుగులో తీసేస్తాను, దానికి ఏం అభ్యంతరం లేదు. మనకి ఎగ్జామ్లో క్వశ్చన్ అనేది ఎలా వస్తుందంటే, ఇప్పుడు మీకు ఆ క్వశ్చన్స్ అనేవి ఇప్పుడు ఇంగ్లీష్లో వస్తాయి, అవునా కదా. ఇప్పుడు నేను తెలుగులో కావాలంటే మీకు అర్థమయ్యేలా చెప్పేస్తాను. కాకపోతే మీరు ఎగ్జామ్ రాసేటప్పుడు మీరు అది అర్థం చేసుకొని దాన్ని రాయగలగాలి కదా. సో తెలుగులో తీయడం ఎంతసేపు అమ్మా? మా ఆల్మోస్ట్ నేను క్లాస్లో చెప్పే చాలా సింపుల్ ఇంగ్లీష్లోనే చెప్తున్నాను క్లాస్ మొత్తం ఆల్మోస్ట్. సో ఈ ఎక్స్ప్లెనేషన్ ఇచ్చే ఇంగ్లీష్ కూడా మీకు కష్టం అనిపిస్తే తర్వాత మీకే అది ఫ్యూచర్లో చాలా ప్రాబ్లమాటిక్ అవుతుంది. ఎందుకంటే ఇప్పుడు అన్ని ఎగ్జామ్స్ కొన్నిసార్లు రిటర్న్ ఎగ్జామ్ ఉంటుంది, కొన్నిసార్లు ఇంటర్వ్యూస్ ఉంటాయి. సో మీరు అక్కడ ఇంటర్వ్యూని ఫేస్ చేసే ముందు మీరు ఫస్ట్ కాన్ఫిడెంట్గా ఉండాలి మీరు మాట్లాడేటప్పుడు కదా. మీరు ఫుల్ కన్ఫ్యూజన్లో ఉంటే కష్టం అవుతుంది. సో నేను క్లాస్ తీసేటప్పుడు తెలుగులో తీస్తాను, యాజ్ వెల్ యాజ్ ఇంగ్లీష్లో కూడా తీస్తాను, భయపడకండి. సో దిస్ ఈస్ ద ఫస్ట్ స్లైడ్. Okay. The male sperm contributes an chromosome and the female ovum contributes an dash chromosome. Here, if you look at the male sperm, what it will contribute, which kind of chromosome it will contribute, whether it is male will contribute X and Y or male will contribute X and X. And what about female, whether she will contribute X and Y or whether she will contribute X and X, which one? Which one is possible? The male can able to contribute only which one? He will be able to contribute XY or XS. Just comment in the comment section whether they will be able to contribute XY or XX. Those who are online, 22 members online unnar kada. Yes, male will contribute XY and female will contribute XX. Exactly. Suha, Sitti, K, Deepthi, good. You have told correctly. Yes, they are going to contribute X and a Y chromosome in a male, whereas the female will contribute only X chromosome. Then the next slide. Fertilization produces a total of 46 chromosomes including an So, dash combination means combination for male combination, what kind of chromosomes will you get, and for a combination of female, which kind of chromosome will get. So, for the male, what kind of contribution they will be getting, the chromosome pattern I am asking, XY or XX for the male person. For the female child, what will be the contribution? Yes, Manju Ambiger, XY for male and XX for female, and Pasha female for double X. Yes, yes, you are told correctly. So, for the male, they will be contributing X and Y, whereas for the female, the contribution will be double X. So, here the Y stands for the male chromosome. Then, organogenesis occurs during the first trimester of pregnancy, especially the days of gestation are, you have to guess the days of gestation. So, organogenesis means what? The development of the fetal organs. The fetal organs, whatever is there, that is called as the organogenesis. So, it occurs during the first trimester, during the first 3 months of pregnancy it will occur, but especially days I am asking here. So, what will be the days? So, it will be like, so the days will be from 14 to 56 days of gestation. So, it already starts from the 2 weeks of the gestation. Exactly, okay. So, Suha, you are saying it as 6 weeks, right? Okay. Okay. Implantation in the uterus occurs dash days after ovum fertilization. Here we are talking about implantation. Can you see the image here? So, implantation occurs dash days after ovum fertilization. Implantation is nothing but, see, the ovum, when it is in the embryo zygote form, it travels from fimbria, and it travels and it gets here. The process is called as the nedation. So, in this nedation process, so ee nedation process lo slight bleeding kuda vastadi, avuna kada, and especially the endometrium during pregnancy is called as what? The endometrium during the pregnancy is called as the decidua. So, this implantation process occurs at what days? Okay, 6th day. Prama Chatterjee, sahi bola aapne. So, from 6 to 10 days. So, here I am asking you about the range here. So, the implantation in the uterus occurs 6 to 10 days. Then, the dash is the outermost extra embryonic membrane that gives rise to the placenta. So, if you look at the placental here outer membrane, so what is the name of that outer membrane? What is the name of the outer membrane here? Outer membrane of the extra embryonic membrane that gives rise to the placenta. Through that only the placenta rises. Tithium, okay. Tithium, you are my paid member. So, yeah, you are saying it correctly. That is the chorion. Sitti chorion, B Kalyani chorion. Exactly. So, the chorion is the outermost membrane, which is the outermost extra embryonic membrane that gives rise to the placenta. The corpus luteum secretes large quantities of dash. So, the corpus luteum, so here this is the corpus luteum, right? So, this is the corpus luteum. What it secretes? It secretes what? And that particular hormone name starts with P, and it is also called as anti-abortion hormone or pregnancy maintaining hormone, that particular hormone name. Yes, Tamil Selvi, Prama Chatterjee, Suha, yes. So, the corpus luteum secretes the progesterone hormone, and this is also called as the anti-abortion hormone or pregnancy maintaining hormone. Next, I would like to show the image of image of this particular image, and you have to guess what this particular instrument is, which we will use in the obstetrical and gynecological nursing here. So, the procedures we use. Josas, welcome, hi. Divya, one more viewer, Divya Konda, yes, speculums, correct, yeah, Tithium you told correctly, that is Sims double-bladed speculum. This Sims double-bladed speculum, one is for the nulliparous women and the other is for the multiparous women. So, that is called as the Sims double-bladed posterior vaginal speculum. In the vaginal wall, in the posterior side, they are going to place. So, these two blades will be unequal in size, one for the nulliparous women, other for the multiparous women, especially to inspect the cervix and vagina and to detect any injury following the delivery and to clean the vagina following the delivery and to inspect the cervix. Understood? So, this is called as the Sims double-bladed posterior vaginal speculum. See, in any viva time or during any interview time, if they ask in particular, you should say the complete name, not Sims speculum, Sims double-bladed posterior vaginal speculum. Next question. From the 8th week of gestation through delivery, the developing cells are known as. From the 8th week of gestation through delivery, the developing cells are known as. So, since the pregnancy till the development cells are known as what? Okay, Suha. So, Suha is telling that is called as the fetus. Suha, Tamil Selvi, correct sonningama. Next, Tithiyam, okay. That is called as the fetus. One second, I need to do. Okay, next question. The union of a male and a female gamete produces a zygote which divides into the fertilized dash. See, here they are telling about the union of the male and female gamete produces a zygote. Okay, it has a byproduct, it has a produces zygote which divides into the fertilized. So, it is happening where? Yes, Divya, yes. So, it is happening in the fertilized ovum. So, inside the ovum all this fertilization is taking place, not inside the sperm. Don't delete your answers. Endu delete chestunnaramma? Okay. Spermatozoa or their fragments remained in the vagina for dash hours after sexual intercourse. So, after the sexual intercourse, the spermatozoa or the fragments remain in the vagina for how many intercourse? After sexual intercourse. For how many hours? Okay, I will write the options here, 24, 48, 72. So, now tell me. A, B, C. So, this is slide number 15. So, what it could be? Option A, B or C? Okay, Prama Chatterjee and T. Rani. Okay, Prama Chatterjee, T. Rani, you have told correctly. So, that is what? 72 hours. So, spermatozoa, the fragments remain in the vagina for 72 hours after sexual intercourse. Next question. Implantation occurs when the cellular walls of the blastocyte implants itself in the dash, usually 7 to 9 days after fertilization. Here I am talking about the internal layer of the uterus. So, where blastocyst, where it is going to implant? Can you see the ovary here? So, this is the ovary, right? So, this is the fimbrium part and it is traveling here. This is the ampulla region and it is traveling, it is going to the isthmus and here the implantation is taking place. So, the implantation when the cellular walls of the blastocyte itself. So, what is that is called? Prama Chatterjee. Okay. Yeah. So, that is called as the endometrium or the decidua correctly. Next question. Okay, next 17th slide. Heart development in the embryo begins at dash weeks and is complete by the end of the embryonic stage. See the heart development, you can see the heart development in the embryonic begins at how many weeks, and it is complete by the end of the embryonic stage. So I will write it as 2 to 4 weeks or 8 to 12 weeks or 14 to 18 weeks. So how many weeks? Option A, B, C. Now tell me. So here I have given you option. So which one? So the heart development in the embryo, begins at 2 to 4 weeks. It begins at 2 to 4 weeks and it is complete by the end of embryonic stage. Now one more picture. Guess what this particular diagram is. So full name you have to tell me, ma. Full name you have to tell. What is this? So this is also one kind of speculum, right? And this is also used to visualize the, yes, Prama, Guna, Esteru, Sitti, Simji Raju, Titiyam, Tadisina Rani. Okay, this is not cuscus, it's cuscose speculum. So cuscose bivalve self-retaining vaginal speculum. So cuscose bivalve self-retaining vaginal speculum. It is mainly used to visualize the cervix and vaginal fornices for any local case of to know any polyp cases or any ectopic of pregnancy, and to inspect the cervix and to prepare the cervical smear for cytology screening, and to detect any leakage of liquor from the cervical region. So during pregnancy, when the or the labor has started, to detect that, we use this cuscose bivalve. So bivalve means here two blades are there, right? So bivalve self-retaining speculum. And the next topic will be about, next question is about regarding the menstruation. If a patient misses a menstrual period while taking an oral contraceptive exactly as prescribed, she should dash taking the contraceptive. So whether she should continue taking the contraceptive or she should discontinue taking the contraceptive. When the patient misses a menstrual cycle, though she is using an oral contraceptive, ante already tablet vadutundi, dan tarvata periods miss ayindi. So whether she should continue or she should discontinue. Here the question is about whether she should continue, because she has missed her period and already she is on OCP pills, whether she can continue or she should discontinue. Yes, second tab, next day. Yes. The T Rani, Tamil Selvi, City. Okay, Josas, yeah. You should, the patient should continue, though she has missed her periods or the oral contraceptive pills, whatever there, she has to continue. Then the first menstrual flow is called as menarche and maybe anovulatory infertile. So that particular phase is called as the anovulatory menarche, or the first periods is sometimes called as the telarche. And the next questions will be about the labor and delivery. So during labor, to relieve supine hypotension manifested by nausea and vomiting and paleness, turning the patient on her dash side. So when the patient is on hypotension, so we should turn the patient on which side, whether on the left side or on the right side. Already the answer is visible. Okay. So when the patient has hypotension, So, whether we should turn the patient onto the left lateral side. Okay, Vijay Lakshmi Tekkam. Yes. So, mana patient ni left side ki mana patient ni tippavalsi untundi left lateral side to relieve supine hypotension. Okay. During the dash phase of the first stage of labor, the cervix is dilated to 8 to 10 centimeter and contractions usually occur 2 to 3 minutes apart and last for 60 seconds. So, here I am asking about the phase. So, what it can be? The latent phase, the transition phase, active phase, which one it could be? So, during that phase of this first stage of labor, the cervix is dilated 8 to 10 centimeter. So, the patient should be turned to which phase, during which phase the cervix is dilated to 8 to 10 centimeter. So, in other terms we can call it as the transition phase. Yes, transition. Someone has told transition just now. Okay. Next, guess the image. So, what is this image is here? What is the image stands for? Means what gynecological instrument I have shown you on the screen right now? So, what instrument is this? Yes, this is Prama Chatterjee, yes. So, this is called as the multiple toothed valcellum. If you look at this multiple toothed, here the edges of this particular instrument will be in this way. So, that is why this is called as the multiple toothed valcellum. So, it is mainly used to catch hold the anterior lip of the cervix during dilatation and evacuation procedure and during the suction evacuation. So, and also the main disadvantage of this is due to these rough edges, it causes the damage to the vascular cervix. It causes damage to the vascular cervix. So, instead of this, they use the Alice tissue forceps. And so, instead of this multiple toothed valcellum, they go for this Alice tissue forceps. Next, the first stage of labor begins with the onset of labor and ends with full dilatation of cervix at how many centimeters? See, the first stage of labor, whether it is 2, 4, 8 or 10 centimeters, tell me. So, the first stage of labor, usually the first stage of labor begins with onset of labor pains to full dilatation of the cervix. So, what is the full dilatation of the cervix? Harichandu, yeah, exactly you told, that is multiple toothed valcellum, exactly. That is what I was expecting all of you to answer the question, multiple toothed valcellum. So, during the first stage of labor, begins with the onset of labor. So, how many centimeters? Manju. So, Manju has told correctly. Manju, Janakrishna have told correctly, that is 10 centimeter. So, cervical dilatation full ga unnappude manam dani first stage of labor antam. Next, the second stage of labor begins with full cervical dilatation and ends with what? So, the second stage of labor has started and second stage of labor starts with full cervical dilation, 10 centimeter cervix dial అయిపోయింది. ఇంకా ఏ స్టేజ్తో ముగుస్తుంది? This was one of my interview questions at Military Nursing Service. When I attended this Military Nursing Service interview, they asked me this question. I knew this question thoroughly. So, 4 stages fat అని చెప్పేసాను అనమాట. Yes, yeah, delivery of the baby, Suha expulsion of the fetus, T. Rani, Chandu, Guna Estaru, Tamil Selvi, అందరూ కరెక్ట్గా చెప్పారు. So, it ends with the neonate's birth. Exactly, you people are taking time and ఇన్స్టెడ్ ఆఫ్ ఆప్షన్స్ ఇవ్వకుండా నేను మీకే ఇస్తున్నాను ఆన్సర్, సో దట్ యూ పీపుల్ కెన్ టైప్ అండ్ ఆన్సర్, అండ్ యూ పీపుల్ ఆర్ ఎక్స్ట్రాడినరీ, యూ పీపుల్ ఆర్ గివింగ్ బ్రిలియంట్ ఆన్సర్స్ without giving any options to you. And the third stage of labor begins after the neonate birth, and it ends with what? So the third stage of labor ends with what? It starts with the birth of the baby, right? And it ends with which one? Yes, Divya Konda, my paid subscriber. Yes, it starts with, ends with the expulsion of the placenta. Estaru Rani, Simi Raju, Tamil Selvi, Mamta, Prince Yo-Yo Channel. What kind of name? Okay. Tiyam, Dippa, Harichandu, Manju, Abba. Andaru ee roju full form lo unnaru pa. Everybody is giving brilliant answers today. Okay. Next, the first stage of labor postpartum stabilization lasts up to, so the postpartum stages, it lasts up to 4 years. Okay. So after the placenta is delivered, this time is needed to stabilize the dash physical and emotional state after the childbirth. So after the delivery, whether, so on fourth stage we will be mainly focusing on whom? Whether on the maternal physical emotional state or on the fetal emotional state, mother or the fetus. Mother or the baby. Yeah, Suha. Yeah, exactly. So till 4 hours, so it lasts up to 4 hours, the last fourth stage. So we will be mainly focusing on Subbu Karthi, Simji Raju, Sitti, Tamil Selvi, Divya Konda. Yeah. So on the mothers. Now guess this instrument name. What is this instrument? This is a metal instrument, you can see, and here on this metal instrument, here you can see the small means to mark the measurement. So where it is used, why it is used? Yes, Prama Chatterjee. This is called as the uterine sound, and it is a olive pointed graduated malleable metallic uterine sound, especially to measure the length of the uterus. So this is how it looks. This is called as the uterine sound. Next. Unlike false labor, true labor produces regular rhythmic contractions, abdominal discomfort, progressive descent of the fetus, bloody show, and progressive effacement and dilatation of what? So, unlike false labor lo kaakunda usually true labor lo emoutundi, rhythmic contractions untayi, abdominal discomfort undi, so gradually the fetal head will descend. So this is how a primary mother's cervix usually looks like. So this is internal os, this is external os. So gradually there will be bloody show, the mucus plug whatever will be there, that mucus plug will come out, you can find the white discharge, then bloody show over there, and this particular stage is called as what? Yes. Suha, Sitti, Titiyam, Dipti, Manju, Pasha. Pasha, you have told uterine sound correctly. Okay, the rest of the people you have answered correctly. So it is we are talking about the cervix dilatation, that is cervix effacement. Okay, when used to describe the degree of fetal descent during labor, floating means the presenting part is engaged in the pelvic inlet but is freely movable, ballotable over the pelvic inlet. So let me show, see, if you look at this pelvic brim, so this is the pelvis, okay, this is the pelvis, this is the pelvis we are talking about. So this is how a pelvic bone will be, right? So here we have this pelvic brim. So when we are describing the fetal descent during the labor, floating means till now the baby's head is not at all engaged, So once it is engaged and it is going down, descending down, then that will, the then the head will not be floating. So, till that if it is not engaged, we call it as the floating, means it has not yet reached and it has not been engagement has not yet happened. Next question. When used to describe the degree of fetal descent, engagement means when the largest diameter of the presenting part has passed through the, so the largest diameter of the presenting part may be head, face, mentum or chin, face presentation or frank breech presentation will be there. So, the presenting part has to, so this particular area is called as what? Whether it is called pelvic inlet or pelvic outlet. So, which one? So, when you used to describe the degree of fetal descent, when the baby head is going down, so engagement. So, the engagement means the largest diameter, the presenting part has passed through the pelvic inlet or pelvic outlet. So, it is called a Divyakonda, you have told correctly, that is it has passed through the pelvic inlet. Okay. Fetal stations indicates the location of the presenting part in relation to the dash. It describes as -1, -2, -3, -4 or -5 to indicate the number of centimeters above the level of ischial spine. Station -5 is at the pelvic inlet. See, మనకి ఈ పెల్విక్ బోన్ ఏదైతే ఉందో, పెల్విక్ బోన్ ఇంకా బేబీ హెడ్ ఎప్పుడైతే గ్రాడ్యువల్గా కిందకి దిగుతుందో ఈ పర్టికులర్ ఈ పోర్షన్ ఉంది కదా, సో ఒకవేళ ఈ స్పైన్ పైన ఉంటే మనం దాన్ని -1 -2 కింద మనం క్యాల్కులేట్ చేస్తాం. ఒకవేళ ఈ పాయింట్ ఈ స్పైన్స్కి ఒకవేళ దాటి బేబీ హెడ్ కానీ కిందకి వెళ్తే మనం బేబీ హెడ్ స్టేషన్ ఏమని అంటాం, +1 +2 +1 +2 +3 +4 +5 అని అంటాం. సో ఈ పర్టికులర్ ఈ ఆర్గన్ నేమ్ ఏంటి? 1 సెకండ్ ఇక్కడ ఇవ్వండి. Yes, T Rani. So I am asking, so this particular spine is called as what? Yes, that is called as the ischial spine. So the name antaru ischial spine antaru. సో ఆ ఇస్కియల్ స్పైన్ పైన ఒకవేళ బేబీ హెడ్ ఉంటే మనం దాన్ని అన్ని మైనస్ స్టేషన్ కింద వేస్తాం. ఒకవేళ ఇస్కియల్ స్పైన్ దాటి కిందకి వెళ్తే దాన్ని +1 +2 +3 +4 కింద వేస్తాం. అండ్ ఎగ్జాక్ట్గా ఆ పర్టికులర్ ఇస్కియల్ స్పైన్ దగ్గర మనకి హెడ్ స్టేషన్ వచ్చేసి 0. నెక్స్ట్, fetal stations are described as +1 +2 +3 or +4 or +5 indicate the number of centimeters. It is below the level of the dash station. 0 is at the level of the ischial spine. So the answer for this question is also is same, that is ischial spine. Already meer answer chesindi same thing. Identify this particular instrument which is used in this OBG. So what is this instrument used for? Yes, Deepa Gurumurthy. Yeah, Deepa Sitti Smiji Raju retractor. So this particular instrument, this is called as the Doyen's retractor. It is mainly used to retract the abdominal wall as well as the bladder for proper exposure of lower uterine segment during LSCS. See, when they are performing this LSCS time, to proper visualization of the bladder. So, proper visualization of the bladder and lower uterine segment, this particular Doyne's retractor is used. If you look at the shape here, so this shape here only they are going to catch hold the muscle and they are going to visualize the organs. Then, any vaginal bleeding during dash should be considered a complication until proven otherwise. So, any vaginal bleeding during the, so here the question is about non-pregnant or pregnant. So, any vaginal bleeding during the dash should be considered a complication until proven otherwise. Where during which time of phase we will consider the bleeding as a very complication thing? అంటే ఏ టైంలో నార్మల్గా పీరియడ్స్ టైంలోనా లేకపోతే ప్రెగ్నెన్సీ టైంలోనా ఏ టైంలో మనం ఇలా బ్లీడింగ్ అయితే వి కన్సిడర్డ్ ఇట్ యాజ్ అ కాంప్లికేషన్ థింగ్? ఎస్, సో డ్యూరింగ్ ద pregnancy time. So, during the pregnancy time, if we find a vaginal bleeding, then definitely it's a complication. Next. So, during delivery, if the umbilical cord can't be loosened and slipped from around the neonate neck, it should be clamped with 2 clamps and dash between the clamps. So, during the delivery, what we will do? We put a clamp, right? So, one side of the clamp when the placenta is inside the womb and one is connected to the baby. So, we will put a clamp over 2 sides. So, whether the 2 clamps between the clamp, what we should do? Whether we should uncut or cut it? Should cut the clamp or just we should uncut or tie the clamp like that? Yes, yeah, 2.5 centimeters to 4 centimeters above we are going to put that one. So, how we are going to, whether we are going to tie or cut the clamp? So, loyal like he, Tamil Selvi, yes, we are going to cut the, between that we are going to cut the clamp, between the clamps. Cut, not uncut, cut, we have to cut. So, during the first stage of labor, the dash usually provides the greatest degree of comfort, although the patient may assume any comfortable position. Here I am talking about the position I am asking, whether it is the supine position, prone position or side lying position. So, during the first stage of labor, so the first stage of labor is what? Onset of labor pains to dilatation of the cervix to 10 centimeters, right? So, during the first stage of labor, the greatest degree of comfort for the mother will be in which position? It will be in, yes, Tamil Selvi, Divya Konda, you have told correctly. So, the mother will have a greatest comfort in the side lying position. Next, dash is artificial rupture of the amniotic membranes. So, here you can see this picture, right? So, what they are doing here, a pregnant mother is lying and this is the fetus, and you can see with the Doppler, with the guided Doppler, they are inserting one needle and they are checking one thing. So, that particular procedure ni emantaru? Artificial rupture of amniotic membranes ni emantam manam? So, dash is the artificial rupture of the amniotic membranes. Yes, Prince Yo-Yo channel, it's amniocentesis. Loyal Likhi, Abhirami, T. Rani, Divya, Tamil Selvi. Yes. So, amniotomy or amniocentesis. So, this is the artificial rupture of the amniotic membranes. Ma, whether audio is okay, ma? Everything okay? No disturbances, no? Okay. The dash phases of a uterine contraction are increment, acme and decrement. So, here the question is about how many phases of the uterine contraction. So, the uterine contraction names are increment, acme and decrement. So, how many phases are here? Little bit big, ma'am. Whether my voice or the screen you are telling? Voice is audible, eh? Yes, T. Rani. Okay. Yes, Guna Estaru, Rajeshwari Kanda. So there are 3 phases of this uterine contraction. So the intensity of labor contraction can be assessed by the indentability of the uterine wall at the contraction peak. Intensity is graded as, so the intensity is graded as mild, moderate and strong. So the contractions here, the intensity of the labor contractions, we can term it as mild, moderate or moderately tense or the strong board like. So these are the types of the intensity of the labor contractions. So the frequency of uterine contractions which is measured in dash is the time from the beginning of one contraction to the beginning of the contraction. See, when the mother has these contractions, now mild, moderate, severe. So how we are going to measure? Whether we are going to measure the contraction in minutes or in hours. One contraction will last and it will end with the beginning of the other contraction. So one contraction is happening, the second contraction is happening. So how we are going to measure? In the hourly basis or on minutes basis we are going to measure the contractions. So we are going to measure the contractions on the based on K. Deepthi Abhirami, you have told correctly, minutes. So not hours, we have to calculate the contractions based on the minutes. So before internal fetal monitoring can performed, a pregnant patient's cervix must be dilated at least 2 centimeter. The amniotic membranes must be ruptured and the presenting part of the fetus, the scalp or the buttocks must be at station dash or lower so that a small electrode can be attached. See, when the baby head is means the baby head is coming out and they want to monitor the baby head through the patient cervix. So at least it will be 2 centimeter dilated. So where should be the baby's head station? Whether it is +1 or -1 or +2 or it should be on the -2. So where should be? అంటే ఏ స్టేజ్లో ఉన్నప్పుడు మనం ఆ బేబీని ఫీటస్ని మనం మానిటర్ చేస్తాం. So we are going to monitor at the minus station, at the station -1. Next, guess this instrument. So this is mainly when the baby's head is stuck or the maternal exhaustion, the mother is not bearing down properly. At that time we are going to insert this instrument. So 2 instruments I have placed here. So the 2 instruments here, if you look at this, so this is how it looks like. This is called as the inside curve is called as the cephalic curve because this is going to grab the baby's head, right? This is cephalic curve. And this will be going inside the uterus, the outer portion, that is called as the maternal curve. That is called as the maternal curve, right? Or the pelvic curve, or we also call it as the pelvic curve. So what are these called as? This is known as, so this is known as the short curved obstetric forceps. So this is called as the short curved obstetric forceps, and this is the Wrigley's forceps. So this is called as the Wrigley's forceps, whereas this one, this is called as the long curved obstetric forceps. So understood, no? This is cephalic curve, this is cephalic curve, this is outside layer is called as the pelvic curve, and this is called as the shank. And here we are going to lock the blades, and this is the handle. For the long curved obstetric forceps, even we have a screw type to lock it, and this is for the pelvic guard, and this is called as the handle. And how we are going to insert it? So one forceps will be separating the 2 forceps, and one forceps we will be inserting, we will be place it on the baby's, so inside the So we are going to place one blade at a time and we will put it down, then the other blade at a time, and it is going to wrap around the ante baby head chuttu ila wrap cheyalannamata. Idi babies the sutures కనిపిస్తోందా మీకు ఇక్కడ? సో ఇది యాంటీరియర్ ఫాంటెనల్, ఇది పోస్టీరియర్ ఫాంటెనల్, రైట్? సో ఈ సూచర్స్కి అటు ఇటు పెరైటల్ బోన్కి రెండు పక్కల మనం దీన్ని క్యాచ్ హోల్డ్ చేసి వెన్ వీఆర్ గోయింగ్ టు పుల్ ఇట్ అవుట్, ఫస్ట్ we have to drag the blade downwards and backwards, then straight, horizontal, then upwards and forwards. So this is how we are going to drag it. Then this is also one kind of obstetric forceps. The name of this particular obstetric forceps starts with K. So this is called as the Keyland's forceps. So this is called as the Keyland's forceps. Okay. So previous one what you saw was, this was the short curved, this was the long curved, and this is the Keyland's forceps. Then teenage mothers are more likely to have dash neonates because they seek prenatal care late in pregnancy as a result of denial, and are more likely than older mothers to have nutritional deficiency. See, teenage mothers ante 18 years kanna below conceive అయిన వాళ్ళు, those who are less than 18 years, and they give birth to what kind of babies here, whether it's a term full appropriate weight baby or it will be a low birth weight baby, what kind of baby the mother is going to deliver. So whether it is LBW, VLBW, what kind of babies the mother is going to deliver. Yes, so the mother is going to deliver a low birth weight baby, because they will be in the stage of denial. No, I can't be pregnant, though they have conceived through the illegal way of they have conceived, but they don't want to get the prenatal care and they want to go for, they will be in the stage of denial. One kind of, this is a defense mechanism, they will be in the denial stage. So compared to these other elderly mothers, these teenage mothers will have nutritional deficiencies because they will not be eating properly or feeding themselves properly. So definitely they will have a low birth weight baby children. Then guess this pelvis. So what is this pelvis? If you look at this pelvis, here you can find the sacral alley. So this is the sacral promontory, right? And this is called as the sacral alley. This sacral alley is not here. So what is this kind of pelvis name? It starts with N. Yes, Suha, you have told correctly. This is called as the Naegele's pelvis. So this is called as the Naegele pelvis. The sacral alley is not there here. Then, so this is mainly we can see in early childhood, where the bones remain very soft and the bone calcium ossification will not happen properly, and this is mainly seen in rickets, especially in the rickets type we can see this one. And if once the term rickets comes, this particular pelvis also name starts with the letter R, and usually in childhood changes occurs in the shape of this pelvis. So the classic changes you can see here. So this is called as the rachitic pelvis. Mainly if you look at this, due to the effect of walking, the shape is changed in this way, and due to the effect of lying down, if you look at the sacrum and coccyx, the sacrum and coccyx will be somewhat upper in region because of the effect of lying down position. And the third position, this rachitic pelvis, this kidney shaped this pelvic brim, the pelvic brim will be in the reniform shape or in the kidney shaped inlet we can see. So this kind of pelvis we call it as the rachitic pelvis inlet. All the answer or these notes I will post in my Telegram and also on my WhatsApp group. You can join my WhatsApp group, which link I have mentioned in the description box. If you want to join my Telegram channel, just you can type in the Telegram healthcare_hub. Okay, you can join my Telegram channel there. Okay, what is this kind of pelvis here? It is mainly due to the softening of the pubic bones due to the deficiency of, mainly due to the deficiency of calcium and vitamin D deficiency or lack of exposure to the sun rays. Due to the lack of exposure to sun rays, this particular thing happen. It usually affects the women who have after they have reached their maturity, and the pelvic bone shape looks like this. So, this is called as the osteomalacic pelvis. So, this is called as the osteomalacic pelvis. Osteomalacia is also, you know, no, softening of the bones. The same thing we can find it here. Next, the narrowest diameter of the pelvic inlet is the antero-posterior diagonal conjugate. If you look at the narrowest diameter, this is the how? So, this is the symphysis pubis bone, this is the sacral promontory. So, okayala question ochindi ante meeku what is the narrowest diameter in the pelvic inlet? There are almost 3 diameters here. One is obstetric and diagonal. So, here we call the true conjugate as the this one, the obstetric conjugate, the red color line you can see na. So, that is called as the true conjugate. So, through this only this is called as the narrowest one compared to the this other inlet. So, this is the narrowest and this is the called as the true conjugate. Then, during labor, the resting phase, the contractions is at least for how many seconds? Whether it is for 20, 30 or for 40 seconds. During the labor resting phase, so the contractions will last for how many seconds? Good afternoon, Geeta. Yes, Rani, Rajeshwari and Tamil Selvi, you have told correctly. So, the contractions will last for 30 seconds. Next question. The length of the uterus increases from dash before pregnancy to dash at term. So, before pregnancy, what will be the usual length of the uterus? That you have to tell here. And before pregnancy and during term, full term, 37 to 42 weeks of pregnancy lo, manaki term pregnancy appudu uterus height ఎంత ఉంటుంది? What will be the uterus height here? So, before pregnancy, the uterus height will be 2.5 inches or 6.3 centimeter. Whereas, after pregnancy, the height of the uterus will be 12.5 inches or it will be 32 centimeters in length. Then, to estimate the true conjugate. So, previously I have told you regarding the 3 types of conjugate, right? So, this is the only true conjugate through which we will come to know whether the presenting part will cross the pelvic inlet, right? So, to know the obstetric conjugate from the tip of the sacral promontory to the symphysis pubis bone lo middle part untade, దీన్నే మనం obstetric conjugate అని అంటాం. సో, దీన్ని మనం మెజర్ చేయాలి అంటే ఎలా మెజర్ చేస్తాం దాన్ని? So, to estimate the true conjugate, we must deduct 1.5 centimeter from the diagonal conjugate. So, whatever the centimeters are there na from here this diagonal conjugate, if you minus 1.5 centimeter, you are going to get the measurement for this obstetric conjugate. So, a true conjugate will be around 10.5 centimeter. అంటే ఈ diagonal conjugate ఎంత ఉంటుంది? ఆల్మోస్ట్ మనకి ఇది 12 centimeter ఉంటుంది. సో, ఈ 12 centimeter నుంచి మనకి 1.5 మైనస్ చేస్తే we will get this 10.5 centimeter. Next, the smallest outlet measurement of the pelvis is the intertuberous diameter, which is the transverse diameter between which tuberosities. So here you can see the two ischial tuberosity. This is symphysis pubis. ఈ ఇమేజ్ యాక్చువల్లీ ఇది ఎలా ఉందంటే ఐ విల్ షో యూ. సో ఇది మన హ్యూమన్ skeletal system కదా, right? So this is how our human skeletal system looks like, isn't it or not? And here I am talking about the distance between these two ischial tuberosities. Distance between these two ischial tuberosities I am talking about. This is how the image is shown here. So the intertuberous antene, it stands for the ischial tuberosities. So those are called as the ischial tuberosities, which is around 10 centimeters. The smallest outlet, this is also called as the ischial tuberosities. ఈ bones మధ్యలో ఉన్న gap నే మనం smallest outlet అంటాం, smallest pelvic outlet measurement. Okay. Dash is used to assess the fetal well-being during labor. If compromised fetal status is suspected, fetal blood pH may be evaluated by obtaining a scalp sample. So here the question is regarding what procedure is shown here. Means using what instrument they are monitoring the fetus inside the baby, fetus inside the mother. So what is that particular instrument name? Okay, this is called as a non-stress test, right? Okay, it is used to assess the fetal well-being labor. So we call it as that one as the electric fetal monitoring. So this particular procedure is called as the electric fetal monitoring. Then dash the uterus helps to stimulate the contractions after the placenta is delivered. So once the placenta is delivered, what we will do? So the external surface, see the mother is lying here, so the placenta is delivered. So what we are going to do to the abdomen? Whether we are going to massage the abdomen or we will tell the mother to take rest. Which one? Which could be the option here? Dash to the uterus helps to stimulate the contractions after the placenta is delivered. So we are going to advise the fundal massage. Yes, Divya, Sindhuja, Deepthi, Suha. Yes, we are going to massaging the uterus. When a patient is admitted to the unit in active labor, the nurse first action is to listen for what? When you are receiving a mother she is in the stage of active labor, right? So as soon as you are receiving the mother, what we are supposed to listen for? Yes, we are going to listen for fetal heart rate. Deepthi, Deepak and Vijayalakshmi. Yes, so we are going to listen for the fetal heart rate. Dash is used to test the pH of vaginal discharge to determine the presence of amniotic fluid. Sometimes due to rupture of membranes, the mother will come to hospital or the primary health care center. So we need to check the pH of that vaginal discharge, whether it is a liquor, amniotic fluid or something white discharge. We use one kind of paper. So what kind of paper? What is the paper name which we will use to check the pH of the vaginal discharge? A vaginal pH check cheyadaniki manam ఏ paper అనేది వాడతాం? Which paper we will use to test the pH, the hydrogen ion concentration pH, whether it is acidic or neutral, to determine what kind of paper we will use? So that particular paper name is known as nitrazine paper. So the nitrazine paper will help to check the pH, and it will help us to know whether it is an amniotic fluid or not. The next, a pregnant patient normally gains 2 to 5 lb weight. So during the first trimester, so how much she is going to put on weight per week during the last 2 trimesters? So during the first trimester, how much she is going to put on weight? First trimester ante first 3 months mother ఎన్ని kgs పెరుగుతుంది? That is the question here. How many kgs? Whether it is 1 to 2.5 kg or 2.5 to 3 kg. How much of weight she will put in the first trimester, first 3 months? So first trimester she is going to put on a weight of 1 to 2.5 kg. Okay, so she will put on a weight of 1 to 2.5 kg during the first trimester. Actual average weight gain is around 12 kgs in a average pregnancy. Okay. Here the question is about, generally checkup is done at interval of dash up to 28 weeks and dash up to 36 weeks and dash till delivery. So how many checkups a mother has to undergo? So till 7 months we will be telling like every month, once a month you are going to go for a checkup till 28 weeks, right? Then when she is on 8th month, every 2 weeks once we are telling the mother to come for checkup, and during the 9th month we will advise for every week during the last month or during last month of delivery. Understood? So 7 months we will tell every month, 7 months 7 times. 8th month weekly, we are 2 weeks once. So this is how you are going to remember it in the exam. So for the first 28 weeks, 4 weeks once. For the 36 weeks, 2 weeks once. And during the last delivery, you have to weekly the mother has to visit. Okay. Precipitate labor lasts for approximately dash and ends with delivery of the neonate. So precipitate labor will be there for how many hours? Precipitate labor అనేది ఎన్ని hours ఉంటుంది? How much the precipitate labor lasts for? 2, 3 or 4? Tell me. So precipitate labor is lasts for how many hours? Yeah, most of you are answering it as 30 minutes. Huh? But in the NCLEX book, they have given it as 3 hours. Maybe I should counter check because most of you are answering 2 hours. So precipitate labor is that lasts for 3 hours. Okay. As an emergency treatment for excessive uterine bleeding, 0. So emergency treatment for excessive uterine bleeding, methergine is given IV over 1 minute while the patient's blood pressure and uterine contractions are monitored. So when the emergency treatment, when there is more uterine bleeding, methergine injection is given, IV injection methergine is given for 1 minute so that the patient's blood pressure and uterine contractions are monitored. Okay. If a fetus has late decelerations ante decreased heart rate, a sign of fetal hypoxia, the nurse should instruct the mother to lie on her left side and then administer 8 to 10 liters of oxygen per minute by mask or through cannula. The nurse should notify the physician and the mother should she should lie in one position. So what is that particular position, Ram? Which removes the pressure on the inferior vena cava. So here I am asking about the position name, whether it is side lying position, prone position or supine position. So, in which position the mother should be? Where it will relieve the pressure over the inferior vena cava. When the fetus has decelerations, means decreased heart rate, and the fetal has decreased oxygen. So, the mother should be in, yes, Divya, Anju, Suha, Tamil Selvi, Sindhuja, Ravikumar. Okay. So, it is the side lying position will decrease the pressure. Okay, first, dash promotes lactation and uterine contraction. Here I am asking about the hormone. This hormone is also for milk ejection. Milk ejection, it will promote lactation and uterine contraction. What is that? And the other name of that particular medicine name is what? Prolactin is for milk production. Milk ejection is what? So, this is oxytocin. Oxytocin injection for uterine contractions, and also this is for milk ejection. Whereas prolactin is for milk production. PP, milk production. Here in the uterine contractions, pitocin or oxytocin is given. Okay. Because oxytocin stimulates powerful uterine contractions during labor, it must be administered under close observation to help prevent complications for whom? Whether for the mother or for the fetus or for both. So, option A, B and option C. Which one? So, because oxytocin is given for powerful uterine contractions, we should monitor the condition of whom? Whether the mother or the fetus or both. Yes, so Sindhuja, yes, Divya, yes. We have to monitor the condition of both mother as well as fetal distress. We have to monitor both of their condition. Then, dash is the process by which the fetal head changes shape to facilitate move through the birth canal. See, the fetal head, you can you usually know the fetal scalp, right? So, this is how the fetal scalp looks like, right? It will be in a diamond shape. Diamond shape. So, diamond shape opening will be there, right? So, the bones will not be complete. The bone ossification is incomplete. The bone ossification is incomplete. When the baby is going through a normal vaginal delivery process, the baby head goes through a series of events. So, what is the series of events called as? Yes, Krishna nursing lecture, Prince Oyo, that is called as, that particular process is called as molding. If a woman suddenly becomes hypotensive during labor, the nurse should dash the infusion rate of IV infusion as prescribed. When the woman is completely into hypotension, when she is in hypotension, whether you are going to increase the IV fluids or decrease the rate of IV fluids? Tell me. Option A, option B. When she is hypotensive, whether you are going to increase or decrease? We are going to Prince your channel. Yes, we are going to increase the IV fluids to the mother. Next, during fetal heart monitoring, early deceleration is caused by compression of the dash during labor. So, when the fetal heart rate is being monitored, the compression of what during the labor? Means why the fetal heart rate will decrease? Because the compression of the fetal head or fetal cord. Fetal heart or fetal cord. So, during fetal heart monitoring, early deceleration caused by the compression of what? Whether during the, so it is mainly due to the loyal hygie. Yes, it's Fetal head, head during the labor, not the cord. Next, after the placenta is delivered, the nurse may add oxytocin to the patient's IV solution as prescribed to promote postpartum dash of the uterus and stimulate lactation. See, after the delivery, the uterus goes a series of events. It will go back to the pelvic organ. So, the pelvic organ, it will be going back. So, what is that particular term called as? The uterus will be reverting back into the uterus, reverting back into the pelvis. So, what is the term called as? So, that is called as the involution, not contraction, it is called as involution. అంటే యూట్రస్ దాని ప్రీ ప్రెగ్నెంట్ స్టేట్లోకి వెళ్ళడం ఏమంటాం మనం, ఇన్వల్యూషన్ అంటాం. నెక్స్ట్, if needed, cervical suturing is usually done between 14 and 18 weeks of gestation to reinforce and dash and maintain pregnancy. See, some women have this not holding capacity. The cervix will be completely, what is that condition called, where they will suture the cervix. So, the suturing is removed usually during the 35 weeks of gestation. So, before delivery they are going to remove the sutures. So, in which condition they are going to apply sutures to the cervix? What is that particular condition name? ఏ కండిషన్లో మనం సర్విక్స్కి సూచర్స్ అనేది వేస్తాం? In which condition? Yeah, cervical encerclage. Okay, very good. So, in the incompetent cervix, you told correctly. So, ఆ cervical suture ni మనం సర్వైకల్ ఎన్సర్క్లాజ్ అంటాము. ఇంకా ఇన్కాంపిటెంట్ సర్విక్స్ని మనం ఇలా సూచర్స్ అనేది వేస్తాం. ఇంకా సూచర్స్ అనేది ఎప్పుడు తీస్తాం మనం, డ్యూరింగ్ 35 వీక్స్ ఆఫ్ గెస్టేషన్ అప్పుడు తీస్తాం. ఫీటల్ డిమైస్ ఈజ్ డెత్ ఆఫ్ ద ఫీటస్ ఆఫ్టర్, సో fetal demise is the death of the fetus after what is the term called as? So, when the baby is living, or the baby is living, the what is the term called as? Fetal demise is the death of the fetus after fetus viability. So, when the fetus reaches the stage of viability, means ability to survive, that is called as death, viability. Then, the most common method of inducing labor after artificial rupture of membranes is through oxytocin infusion. The most common reasons for cesarean birth are malpresentations or cephalopelvic disproportion, or due to maternal hypertension, induced hypertension, or previous cesarean birth, or inadequate progress of labor. In those cases only you are going for the cesarean birth. The most common reasons for the cesarean birth are malpresentations, fetal distress, CPD, cephalic pelvic disproportion, or pregnancy induced hypertension. Dash increases the risk of spontaneous abortion, trauma of the fetus or placenta, premature labor, infection and RH sensitization of the fetus. See here, you can see the image, right? Previously I have shown this image in one particular procedure. So, it increases the risk of spontaneous abortion. So, what is this procedure? In previous slides we have discussed this. So, this particular procedure is called as the amniocentesis. So, this is called as the amniocentesis. Once they do amniocentesis, again there may be a chances of spontaneous abortion, trauma to the fetus, or premature labor will start, or infection or RH sensitization of the fetus will occur. Yes, ultrasounded guided amniocentesis. Very good, Mohit Lal. So, after amniocentesis, abdominal cramping or spontaneous vaginal bleeding may indicate what? Whether it indicates any eventful pregnancy, or it indicates any complications. So, what it can be? So after amniocentesis, abdominal cramping or spontaneous vaginal bleeding may indicate what? Whether it is an eventful pregnancy or it will indicate any complications over here. So the given options is option A and option B. So it will cause loyal Heike, it will cause complication. Next. So to prevent her from developing Rh antibodies and dash should receive RHD immunoglobulin after delivering an Rh positive neonate. So if the mother is, so the question is regarding Rh positive primey or Rh negative primey. So what can be the reason? So the mother is a Rh positive mother or Rh negative mother? Yes, yes, Sindhuja Motilal. So if you look at the Rh incompatibility ఏంటంటే ఒకవేళ మదర్ నెగిటివ్ మదర్ బ్లడ్ గ్రూప్ వచ్చేసి నెగిటివ్ ఉంది. కెన్ యూ సీ ద పిక్చర్? మదర్ ఈజ్ ఏ నెగిటివ్ బ్లడ్ గ్రూప్ ప్రైమీ మదర్ అంటే ఫస్ట్ టైం ప్రెగ్నెన్సీ, కానీ తనకున్న బేబీ మాత్రం పాజిటివ్ బేబీ ఉన్నప్పుడు అక్కడ ఏం జరుగుతుంది, ఫస్ట్ డెలివరీ తర్వాత ఆ మదర్ బ్లడ్ ఇంకా బేబీస్ బ్లడ్ కాంటాక్ట్లోకి వచ్చినప్పుడు సెన్సిటైజేషన్ ప్రాసెస్ వల్ల మదర్లోకి ఇది యాంటీబాడీస్ అనేవి రిలీజ్ అయిపోతాయి. సో నెక్స్ట్ టైం మనకి ఏం కండిషన్ వస్తుంది, ఎరిథ్రోబ్లాస్టోసిస్ విటాలిస్ అనే కండిషన్ వస్తుంది. సో మదర్కి యాజ్ సూన్ యాజ్ ఆఫ్టర్ డెలివరీ వీఆర్ గోయింగ్ టు గివ్ దిస్ RHD immunoglobulin. So it will prevent this erythroblastosis vitalis condition in the future pregnancies. Okay, when informed that a patient's amniotic membrane has broken, the nurse should check the fetal dash and then maternal vital signs. So when the amniotic membranes are ruptured, so what we are going to check, whether the fetal umbilical cord we are going to check, or we are going to check the fetal heart rate, or we are going to check the maternal vital signs. So once the amniotic membrane has broken, we are going to monitor the fetal heart rate. Crowning is the appearance of the fetus head when its largest diameter is encircled by the, this particular term is called as the vulvovaginal ring. So the crowning, head on perineum kuda antaru, crowning antaru. So when the largest diameter is encircled by the vulvovaginal ring. Okay. Dash may occur if the bladder is distended after delivery. So dash will occur. What is that? Whether it is subinvolution or involution. ఇందాక చెప్పుకున్నది ఏంటి మనం, యూట్రైన్ ఆర్గన్స్ బ్యాక్ టు ద ప్రీ ప్రెగ్నెంట్ స్టేట్ పెల్విస్లోకి వెళ్ళడం ఏమంటాము, దట్ ఈస్ కాల్డ్ యాజ్ ఇన్వల్యూషన్, రైట్. సో హియర్ వెన్ the bladder is distended, if the bladder is full of urine and the bladder is distended, what kind of process is called, whether it is subinvolution or involution? It will not go back into the uterus. So that is called as the K. Deepthi, Loyal, Suha, you have told correctly. So it will cause subinvolution, the uterus will not be able to go back. If the bowel is full or bladder is full, if that is distended, subinvolution will take place. Next, for an extramural delivery, one that takes place outside of a normal delivery center. Usually we called it as a booked case, unbooked case. Booked case ante enti, regular ga tanu oka hospital visit chesi checkups, antenatal visits chesinappudu, that is called as the normal, or we call it as booked delivery, right. కానీ ఒకవేళ డెలివరీ ఈజ్ హ్యాపెనింగ్ extramural, outside of the hospital, outside of the healthcare facility, the priorities for care of the neonate including a patent airway. So we will be also monitoring regarding the patent airway of the baby and supporting efforts to breathe, and we will be also monitoring what and all things. Usually when we receive one patient, what we are going to monitor, the general thing, the general VS, What is this Vs? So as soon as you are receiving a baby, you are receiving from the, she has delivered outside and you are receiving the baby, what we are supposed to monitor for the baby? Immediately you are receiving a newborn here, what you are going to monitor? మీ చేతికి ఒక న్యూ బార్న్ బేబీ వచ్చింది. సో ఇమీడియట్గా వీఆర్ గోయింగ్ టు వాట్, వీఆర్ గోయింగ్ టు వైప్ ద బేబీ, వీఆర్ గోయింగ్ టు చెక్ ద vital signs. Yes, exactly. K Deepthi Suha, we are going to watch for the vital signs and maintaining the adequate temperature of the baby. Okay, tell this instrument name. Here you can see the, so this is the image A. Tell this, what is this instrument name? This is mainly used for this ARM process. What is this ARM? Artificial rupture of membranes. We will use this type of scissor. So what is this scissor name? If you look at the scissor tip gan chuskunnatlaite, it will be a sharp pointed tip and bottom will be a this double tip like that it will be. So it is called as Cocker's. Yes, Mohit Lal, it is called as the Cocker's forceps, and this is mainly used for low rupture. This is mainly used for low rupture of membranes. So for this they are going to introduce through this way and they are going to rupture the bag of water. This is called as the Cocker's artery forceps. Sorry. The administration of oxytocin is stopped if the contractions are there for how many seconds? Whether it for 30, 60 or 90 seconds. Which one? The administration of oxytocin is stopped if the contractions are there for how many seconds? So how you are going to monitor? The administration of oxytocin is stopped if the contractions are there for if the contractions are there for 90 seconds or longer. If their contractions is there for more than 90 seconds or longer, we are going to stop the oxytocin. Okay. During the dash of labor, the woman is usually irritable and restless. So during which phase the woman is irritable and restless? So during the transition phase, the woman will be very irritable and restless. Next, maternal dash is a complication of spinal shock, whether it is hypotension or it is hypertension. Maternal hypotension is a complication or hypertension is a complication of spinal shock? Okay, Akshaya Nalan, more than 70 seconds itself it will increase the risk for mother, ma'am. Okay, so instead of 90 seconds you want to say it as more than 70 seconds itself. Okay, so all of you are saying it is hypotension. So maternal dash is a complication of spinal shock, is that is hypotension. Next, the mother's dash should be determined before an amniocentesis is performed. So before when we are performing this amniocentesis, what will happen? There may be a chances of the maternal blood getting mixed with the fetus blood, right? So the mother should be checked for whether she is a positive mother or she is a negative mother. So what is the term for that one? So the term for it is, we are going to check the RH factor of the mother, otherwise it will cause RH sensitization. Especially if the baby is positive. If the baby is positive and the mother is negative. Okay, with early maternal age dash commonly occurs. So what the at early maternal age what usually occurs? So the term is CPD. What is CPD? With early maternal age what will happen? So when you look at the pelvic brim and the baby head, there will be a disadjustment. So what is that called? CPD is called. So that is called as the cephalopelvic disproportion with early maternal age. If the mother is, if she is less than 18 years of age group, there will be a chances of cephalopelvic disproportion. Then the last question of the session, spontaneous rupture of the membranes increases the risk of a dash. Spontaneous abortion will increases the risk of dash. It is something related to umbilical cord. What will happen to the umbilical cord? Spontaneous rupture of the membranes will increase the risk of dash of umbilical cord. What it will cause to the umbilical cord? Okay, it will cause the fetal distress and also it will cause prolapsed umbilical cord. It will cause umbilical cord prolapse. Okay, many of them have answered Cephalo, Akshaya, Sindhuja, Rani, Harichandu, CPD, you have answered very correctly. Sindhuja, you told correctly, it's caused fetal distress. Mohitlal. So this is the last question of the session and this is the 95th slide. Okay. Thanks for this session and hope you people enjoyed well this session. And tomorrow or day after tomorrow, I will take this, what to say? I will take this how to fill your OMR sheet. If any mistakes are happening in the OMR sheet, definitely it will be ruining your exam. Being selected in the exam, your chances will be very much decreased. Okay. So OMR ela fill cheyalanedi class nenu repu gaani ellundi gaani teestanu. Okay. Okay. So thank you. Take care all of you. Bye bye. Mohitlal enjoyed a lot. Me too. You people were giving superb answers today. Everyone was so active and attentive in the class, means not even you wasted a single second. Your people were giving us shooting out answers today. Very good to know. Very good preparation is going on. Okay, Akshaya, you are saying first time you are watching me. Okay, you are watching me live. Okay, good to know. No problem, no issues. Krishna nursing lecture, prolapsed cord. Okay. దేని గురించి చెప్పండి మేడం? లాయల్ హైకి మార్క్స్ గురించి చెప్పాలా? మార్క్స్ గురించి ఏం చెప్పాలమ్మా? మార్క్స్ ఎలా స్కోర్ చేయాలని చదవడమే ప్రిపరేషన్, ఇంకో దానికి వేరే ఆప్షన్ లేదు. చెప్తాను. ఓకే, టేక్ కేర్, బై.